Mesothelioma is an aggressive cancer that usually stems from exposure to asbestos. It affects the mesothelial cells, which occur in the lining that covers the outer surface of the body's organs. Mesothelioma most commonly affects the pleura, or the lining of the lungs, but it can also appear in the lining of the heart and the abdomen. It is relatively rare. Every year there are about 3,000 new diagnoses in the United States. There is no cure for mesothelioma, but palliative therapy may improve a person's quality of life. What is mesothelioma? Mesothelioma usually affects the outer surface of the body's organs. Mesothelioma is an aggressive form of cancer, meaning that it progresses and spreads quickly. There are three types. Pleural mesothelioma, this is the most common form. It affects the pleura, the lining around the lungs. Peritoneal mesothelioma, this is the second most common form. It attacks the lining of the abdomen, called the peritoneum. Pericardial mesothelioma, this is the rarest form. It affects the protective layer of the heart, called the pericardium. After diagnosis, 55% of people will survive for at least another 6 months, 35% for a year, and 9% for another 5 years or longer. The survival rates vary, however, between types. Can mold make you sick? Learn more here. Symptoms. On average, mesothelioma takes 30 to 45 years to appear. Some people experience symptoms after 10 years, while others remain asymptomatic for 50 years. The length of time will depend, to some extent, on the intensity of the asbestos exposure. Genetic and other individual factors may also play a role. The average age at diagnosis of pleural mesothelioma is 72 years. Symptoms vary, depending on which part of the body the disease affects. Pleural mesothelioma. The symptoms of pleural mesothelioma include shortness of breath, coughing, often with pain, sudden and unexplained weight loss, pain under the rib cage, detectable lumps under the skin in the chest area, lower back pain, discomfort in the side of the chest, exhaustion, sweating, fever, difficulty swallowing. Peritoneal mesothelioma. A person with peritoneal mesothelioma may experience unexplained weight loss, abdominal pain and swelling, lumps in the abdomen, nausea and vomiting. Pericardial mesothelioma. Pericardial mesothelioma can cause low blood pressure, shortness of breath, fluid retention, or edema, often in the legs, heart palpitations, extreme fatigue following light exertion, chest pain. If you like this video, kindly subscribe in this channel. Baby time FYI. Thank you.